Okay, so this is getting the run from the person that started it while I was attending to patient care. So this would ideally be charting either en route or at the hospital after we've transported the patient. So what I like to do is do a systematic breakdown of each section and then move on once I'm done with that. So as you can see, my EMT started this portion and got this all filled in, so I can move on from here. So basically I'm just going through and looking, making sure it's all filled out. He's got my hospital in there. My times are in. As you can see here, my times have not been filled out, so what I'm going to do is go to the top of the screen. I'm going to hit CAD, and as long as I have connectivity, then that will autofill. Now this is a practice patient, so it's not going to autofill, so use your imagination here. My EMT will also tell me my mileage, so I'm going to fill in scene and then destination, and it'll auto-populate how many miles were loaded there. So now I can see that all of my pertinent negatives have been filled out on this page, so I can move on to my next, which is a patient. Ideally, this is the page you want the person that opens the run to start while you're on scene. So last name, first name, date of birth are the very least that you can get. If you can get a social security number, that's even better. Their address, phone number if you can get it, and then medications, allergies, medical history, everything like that. If it's a medication that isn't very common, 9 times out of 10 you're going to have to put it into the other category, which you'll find in medications. Just put other and then fill it in here. I can see that this page is also filled out, so I can move on to the next. For vital signs. Now I can fill out vital signs as the EMT who opened the run by the quick tab here at the bottom, which we heard Harris say that the blood pressure was 124/82, so I can quick tab that and just hit add. Or I can sync it with a monitor to fill in my blood pressures, or I can just add them here. Whichever way. Usually syncing it from the monitors is the easiest way, but you can do this autofill in as well. It's also going to make you fill out the GCS on this patient. There at least needs to be 1 GCS filled out. Ideally, you're going to want to at least have 2 for your initial assessment and then your following assessments as well. So you're going to want to put in a Glasgow, just a chart that nothing's changed. Now flow chart, we're going to move, and what we did for this patient, for this patient we splinted. So you're probably going to find splinting in the other category. And we're going to go to splint, fracture dislocation. Put your comments, whatever you did. We used a SAM splint with Kerlix. And then just fill out improved, unchanged, probably unchanged, none, and that would be protocol. As far as treatment of a BLS patient, you're not really going to have a whole lot to fill out in the flow chart. Just basic care, whatever you might have done. I know Joel also did some ice packs. We can look and see if that is in here as well. You can put cooling, which would be external, and we'll put other, and then in the comment you definitely want to chart that it's for an extremity injury and not like a cardiac arrest cooling. So we're just going to fill that in here, that it was for a leg injury, that we were cooling due to swelling, trying to reduce swelling of the joint. And then again, just fill out over here who did it and the outcome of it. Next, you want to do assessment, and you're going to want to go through these and systematically go through. The one thing you never want to do is just click no abnormalities. That's the last thing that you want to do, and NSAID is a big no-no with him. So you just want to go through. Patient wasn't necessarily combative or confused. He was super annoying, but they don't have a tab for that. For the most part, he seemed to be alert and orient ×4, so we're going to fill that in. Skin, what did you see? At the very least, he didn't feel cold, so I can click that. What did his pupils look like just by glancing at him? You don't necessarily always have to use a pen light to see what the pupils started at. Just take a look at your patient as you see him. And if you listen to breath sounds, I didn't see Joel do that. So we'll move from there. Did he vomit on scene? No, he wasn't complaining of nausea. He didn't appear to have any dissension. Back, didn't notice any obvious deformities. Didn't seem to have any tenderness to his pelvic area. Ideally, you're going up and feeling a pulse in either the right or the left arm. In the left leg, he was holding on to his right leg. So he did have some abnormal sensation, possibly a little bit of edema to his knee, possibly other, meaning it was an obvious dislocation, something like that, and you're going to chart that at the bottom. We'll scroll down there in a minute. How did his pulse feel to you when you felt it? Did he have good cap refill? And then down here is where you're going to fill out that other, say, obvious deformity to right knee. You also want to do an ongoing assessment because you've taken a look at your patient on scene. Now you're taking a look at your patient maybe a little bit closer en route. So you're going to go through again and systematically fill all these out. Do your pertinent negatives, what you did and didn't find. Your narrative, you're going to come to primary impression. You're going to look for traumatic injury, I believe it is. In this one, obviously you're looking something that has something to do with an injury. Some of these are different, but there's traumatic injury. Now you're going to say exactly what that traumatic injury was. Knee injury. And then your primary would be probably going to go with pain on this one. It's probably about the easiest way to describe it on this. And then you're going to describe where the pain is. Just scroll down and find knee. Patient was injured. Yes. You're going to fill these out. How did he injure himself? He said he fell. Details. Tripped. Place of injury. We're just going to put other specified place. He was at work. And then the date of the injury. And it should usually have the box around the day that it is. Now, clicking on yes on the injured is going to prompt you to come to specialty patient. Anytime there's an injury from a patient, then you're going to have to fill out the spinal mobilization screen. Now, this has changed since we don't necessarily do backboards and we really only use C-collars, but you're still going to fill it out regardless because it's going to prompt you to regardless. He wasn't altered. He didn't seem impaired. He does have a distracting injury on his knee. Can't really get past that. No neurological deficits and no back pain. So we're going to hit no, but it's still going to recommend that we do C-spine. Billing, it's helpful if the first person that starts the run can get insurance information, but we can either get that from the patient or we can get that maybe off a face sheet at the hospital if we need to. It's not necessarily absolutely dire that we get it on scene, but it is a good idea to get it so we can fill that out. Going to go ahead and scroll down, and this is where you're going to fill out what you used on the run. So we used a SAM splint and some Curl-X on that patient, and then some ice packs. So you're going to scroll down. Hopefully SAM splint's on here. Just keep scrolling until you find it. Sometimes they don't have what on here what you used, but just make sure it's not on here then. So here's Curl-X. Ice packs. And Joel used 2, so we're going to reflect that there. So not SAM splint, but a splint. So there we can document it, just add it. And then the other pertinent thing that you're going to have to do before you can close this run out is what CMS level the patient was. He's a BLS patient, so we're going to fill that out there. And then signatures. You're going to want to get a signature from the patient here. I agree, and then have the patient sign, and then you and your partner sign. Right there. And then you're going to want to get the hospital signature there. And then have them sign or put their name, or you can type their name. But that is now required as well, so you have to have the nurse's name. So you've gone through every section of the chart. Should be done. You still have to put your narrative in. And if you need to check what you haven't put in, which is going to tell us our times still aren't, or mileage. So you just scroll, look. Those are all times, and scene mileage and narrative. This can tell you what you still have to do. And it'll give you a good baseline so you know what to fill out and what you don't have to fill out. And then just make sure you always put the nurse's name and your name as well. And then you should be good.